Now it is my pleasure to pass the floor to Dr. Jane Barratt, Secretary General of the IFA.
Thanks very much, Andra, and I join Andra in welcoming attendees all around the world. The WHO, in the final proposal for a decade of healthy ageing, calls on member states to ensure legal frameworks and sustainable financial mechanisms for the provision of long-term care. Long-term care is one of the 4 key action areas. It talks about and calls on member states once again to develop national standards, guidelines, protocols and accreditation systems for the provision of community social care, long-term care, and also that they are ethical and promote the human rights of older people and their caregivers. COVID pandemic has shown us the life and the death consequences of broken and unfunded long-term care systems. In many countries, an historic lack of investment has resulted in supply shortages, underpaid staff, inadequate infection control, and a lack of transparency, all of which are not acceptable as a societal norm. It gives me great pleasure this morning to introduce Graeme Pryor. Graeme is the co-founder and CEO of Hall & Pryor, a nationally recognised and respected leader in aged care delivery, quality and innovation in Australia. Hall & Pryor was founded in 1992 with a single family-owned nursing home. Under Graeme's leadership, Hall & Pryor has expanded to include 26 centres for healing across Australia, offering world-class amenities and cutting-edge aged care programs. Graeme is definitely a thought leader. He's a visionary. He's passionate about the quality of aged care services through education, workforce enablement, and also through investment in technology and research. He really has a focus on knowledge creation and an evaluation so that there are improvements constantly. Graeme is the father of 5 children. And, Daniel, Andrew, Mason, and the ones that I know most and best of all are Thomas and Isabel. And they're just wee children, like 5 years of age, I think. So, Graeme, I think the important thing also is that I'm very proud, and the staff are, that you are the president of the International Federation on Ageing. So I thank you, particularly at this time, for your leadership with the IFA. And no door remains closed in trying to understand how IFA can be positioned and an important conduit to information. So welcome, and I'll leave it over to you.
Well, thank you, Dr. Jane Barratt, and for everyone around the world, welcome to our town hall meeting. We are facing, I've been involved in aged care for 30 years. Before that, I worked in international accounting bodies, and this is by far the greatest challenge I think we've faced, along with climate change. It's devastating, and we have a lot to do, a lot to learn. But first of all, let me acknowledge, in Australia, it's very customary to acknowledge the traditional owners of the land in which we meet. Although we're meeting around the world, we operate on 27 communities in Australia, and we acknowledge the traditional owners under the land, past, present and emerging. I'm talking to you from my office in Perth, and I sit proudly on what's called Noongar land, Whadjuk land, Whadjuk people land of the Noongar Nation. So welcome to everyone from around the world who has a traditional perspective. Hall & Pryor certainly is, we have been very challenged since early January of this year. Sitting in Perth, we have sort of an orientation to Asia, to China, and China is by far our largest trading partner. So we could see coming through in the wires in mid-December something happening in China, and it was starting to worry all of us around the world. So COVID-19, as it was defined sometime I think in January, comes from a long history of viruses. As we know, SARS in 2002, H1N1 in 2009, MERS in 2012, and a whole series of other earlier viruses over the last probably 700 years of recorded humanity. The origins are identified in Wuhan and has spread mostly undetected around the world, and China first notified WHO on 31 December 2019. Named as COVID-19 by WHO on 12 February, and the pandemic declared on 11th of March. So Australia has, I must say, has not mucked around. This country has left almost no stone unturned on a policy format by all of our governments in this country. And we, at the moment, have achieved a low level of infection and thankfully a low mortality rate. However, worldwide, there's been a report of 4.4 million cases, of whom 1.59 have recovered, but 100,000 reported deaths from COVID-19. And the data will only get worse from here. Internationally, in assisted aged care facilities, reported in New York Times, 10th of May 2020, in New York was 150,000 infections across 7,700 facilities. 27,700 residents or staff at nursing home levels in nursing homes have died as a result of this. And there's a lot of talk around a lot of undiagnosed COVID-19 deaths as well. In the US, 15 states, the number of COVID-19 residential care services amounts to over 50% of the total death rate in those states. Some examples: in New Jersey, 57 deaths at one home, another home in Edison, New Jersey, 54 deaths. In Europe, it's a very similar situation. WHO reported on April 2020, half the deaths took place in assisted living facilities. So as mentioned before, in Australia, we have so far been very fortunate, but a second wave could be around the corner. We don't know. One of my facilities in Sydney, one of my homes in Sydney, had a confirmed positive infection, and I'll walk you through how we handled that and how chilling it actually was. So in Australia, we've had one facility in our organisation that was confirmed positive for COVID, and I'll talk you through in a few moments what has been the impact of that and the impact on our organisation. In the Australian aged care sector, we have a federal government that controls and governs, regulates and funds the provision of aged care services to all Australians. And largely the state governments, the provisional governments, are not involved in the provision of aged care services or regulation of aged care services. So our government here, the Commonwealth government, has moved very quickly. It has provided a $1,000 US bonus directly to frontline aged care staff. It has provided additional $600 per US per resident to aged care providers to help with infection control costs and those sorts of issues. Our national stockpile of PPE at the outbreak of the pandemic was quite low, but the federal government has stepped in and provided a lot of support around that. In Australia, we have about 2,700 aged care facilities, and the total number of COVID cases in those facilities recorded to date has been 63 recorded infections with 26 deaths. And so far Australia, we've done a very good job from that. We prepared in Australia a pandemic plan in 2008 that the federal government launched. I was on the task force for that all through 2007, and the aged care sector had a significant chapter or annexure allocated to it for the protection of our residents in the aged care facilities. I won't say Australia has done a good job compared to other countries, because it's not appropriate, but we've certainly done a good job compared to what we expect in this country so far. We in Australia at the moment are in the middle of a major royal commission of inquiry into aged care quality standards in Australia. It's been going now for about 12 months. It has issued its first report on October the 31st last year. That report was called Neglect, and the final report will be issued sometime next year. So the Royal Commission is looking into infection levels, infection management, pandemic preparation in the Australian aged care context, both for residential care and also for home care. From our point of view in Hall and Prior, we, given my involvement with the federal government and on a number of federal advisory groups, I was very proud to see that the government stepped in and didn't muck around when it came to supporting the aged care sector at a federal level. The regulation stayed very strong, but was largely desktop as opposed to visitations. And they intend to return to visit for on-site visitations sometime, I think, next month. We have a new regulator in Australia. It's the first regulator came into effect in 1997. The second regulator came into effect mid last year, and it's got serious ammunition, very, very well run, and has a lot of support by all stakeholders in the Australian context. So the Australian government wasn't too comfortable with what we call lockdown in this country. Most aged care providers in mid to late March entered into a period of lockdown, which basically meant the protection of our residents, the greater good, the survival of our residents, the safety from infection was the #1 priority. And we've since, across the country, seen a lessening of this lockdown process. The Prime Minister and all the state premiers came out in a fairly unhappy way about that, because it was seen to be against human rights, isolation, mental health, and all those sorts of issues. And they're genuine issues for human rights and human concerns. And the aged care sector has worked with the federal government and have now put in place what appears to be a plan that all stakeholders seem to be happy with, which is called the Residential Aged Care Visitor Access Scheme. And it's very sensible, very logical, allows access, but it leaves a lot of discretion to the directors of nursing, to facility managers to manage access and make sure everyone still stays very safe from that point of view. In terms of the positive case, I've got to say I'm a very hands-on chief executive. I don't run care programs, but I have a tremendous, largely registered nurse, female-led team across our care program of about 2,400 staff and somewhere in the order of 270 nurses, Division 1 registered nurses. And these are tremendous people, and they are very courageous. They step in and they're very capable of managing risk. So our positive case, we were confirmed positive at about 9:36 a.m. Standard Time in Sydney to go. And I must say it was absolutely riveting, chilling to be advised of that. So we stepped in, a 95-year-old gentleman was confirmed positive. We followed our procedures. We have a 300-page pandemic management plan inside Hall and Prior. And at some stage in the very near future, I'm happy to share that with anyone who wants to have a copy of that. My staff in my own office and my senior managers prepare and run this plan. And they followed that plan to the paragraph. And the outcome was that the COVID confirmed individual survived, is alive today. He asked for ice cream after about day 14, which made all of us smile. And we followed strict procedures on that. So today the facility, the home, has no COVID. All the staff were well protected. There is a lot of careful management and managing staff with COVID, because the staff get very scared, they're very frightened, and they have to be protected as well as the residents with PPE and allowed to have all sorts of time off and time away from the home if they think they may have COVID, but not confirmed. So that's our case there. Some lessons learned before we start talking about the whole overall perspective. What are some lessons here that we've learnt so far? And I'm more than happy to talk about how we as a society, as we as a group of very invested human beings can work together and help world government, or governments, support support NGOs, particularly work with governments. We have a lot of work to do, particularly in supporting countries that have really struggled with this. It is a privilege. We all know it's an extreme privilege to care for someone else, particularly someone who's very vulnerable, and there has to be a real social change around that. There needs to be a fundamental shift in the value that we as a society put on health workers, whether they're nurses, doctors, carers, administrators, volunteers, directors, and that really has to be a major campaign for change across the entire universe. Collaboration is certainly essential between all stakeholders in health, we know that. The governments have got an enormous challenge coming their way how to deal with this. And to address the issue tonight, I think we've got a long way to go before the lessons will really be learned out of this process, but we can start right now, of course, and tonight's part of that. So Jane, back to you, and I'm happy to answer any question, no matter how hard it happens to be tonight, in support of this process, and thank you once again.
Okay, thank you very much, Graeme. I have a question for you just as the questions are coming in, and it really is around this visitation and lockdown. I know certainly in Canada, we have really struggled with, the social isolation of older people and opening the doors in a regulated way for visits, etc. So I'd like you to just comment on how Hall and Pryor handled this very important issue of social isolation and families being concerned. Perhaps you could kick off with that question while I collect more.
Of course, I'll get to the heart of this. The people we care for are generally, if I give you a profile here, they're a third male, 2/3 female, or thereabouts. The average age is about 83, and they have 4, 5, or 6 coexisting morbidities. They're very ill people. They're generally quite happy, but they have to be cared for, and they are very, very vulnerable to any kind of infection, whether it's airborne or otherwise. These people are very vulnerable. So this decision was taken by myself, but that's not the case, really. It was taken by about 50 people on a consensus phone call after a lot of very careful thinking what to do for the well-being of these people. So our 27 directors of nursing, all the senior management and quality, our general managers, came together like this on a Zoom call, town hall meeting, and at the end of the third meeting, I was extremely excited to see the senior leadership team stepped up and said, that's it, we must lock down. And when you get that kind of power, you've got to listen to that very carefully. We locked down within about 3 hours. We advised that night all of our family, next to kin, loved ones, residents, doctors, nurses, staff, the whole lot. About 10,000 people were identified and notified very quickly, and our Facebook went sort of off the charts a bit. We had 4 or 5 complaints within about 24 hours, but most people, 99% of the people we were dealing with, supported lockdown, and it's worked. It has worked. But now we're easing restrictions. During lockdown, I do want to say one thing to you though. The directors of nursing got full discretion around things like end-of-life care, palliative care, and emergency involvement with family. So there wasn't a complete isolation. That's not true, but there was extreme protection of human rights around safety.
So really, Graeme, what you said is you listened to your experts.
Absolutely.
Okay, look, I'm going to ask people on the call to ask Graeme the questions. And so I've got a list of them. If you can be reasonably concise with your questions so we can get through a lot. So Erka, Dhar, Manava, and Catherine Fries. So Erka, would you like to kick off the questions?
Yes, thank you, Jane, and thank you, Graeme. My quick question to you is, given all the preparation you've done for this current pandemic in the United States, and I guess globally, we've also heard of a second wave in the fall that could be way more dire. So are you prepping for that in the eventuality that it does come around a second time and could be far worse? And if so, are you sharing with governments and other stakeholders? Thank you.
Okay. So Graeme, we'll take both of the other questions and then you can
Okay. Okay. Yep. I'll make some notes. Yep.
Manava, are you on the line? So Manava's question, Dr. Manava Sivakumar, what are some of the important precautions to be undertaken by older people? And Catherine Fries, are you on the line?
I am, yes, thank you.
Super.
I was curious, were you mentioning that virtual inspections were done of nursing homes?
Yep.
Okay.
Yes, I was.
Over
yes.
to you. Yeah, over to you, Graeme.
Now, yeah.
Yes, please.
I'll address the second one first. Virtual inspections, absolutely. So there's no, by desktop, so the federal agency generally would phone someone like myself and ask for a copy of your pandemic plan and a whole series of questions around preparation for the pandemic and for infection management. And this isn't like a telephone call. It is a phone call followed up by a fairly significant piece of communication out of a federal authority that if you don't follow, you'll be in serious trouble with. Does that answer that question? I think it does.
Yep.
On the issue of second wave, there's in my view, if you look at this in the context of COVID-19, we all know there's no treatment, there's no cure, and any vaccine is a long way away from our people. It may not be a long way away from the most important, I guess you could say, prioritised people by government, but from the point of view of our people over the age of, say, 65, then it could be a long way away. It could be 2 or 3 years. So we are of the view, I'm of the view, and let me just walk you through a few things I do. Besides my work at IFA, on the Workforce Council for Aged Care for Australia. We have about 500,000 people who work in the program on that council. There's 8 of us directing that. I'm on a ministerial appointment to the National Board that advises government and aged care. And my view and the view is that the second wave could definitely turn up, undetected, unannounced at any time in the next 10 years. It would be completely wrong, I think, for someone like myself to take the view that COVID's gone, Australia has ducked the bullets, or other countries have. It's here to stay, and it could be for 10 years out there somewhere. And it could mutate, it could change. It could come back as COVID-21 or 22. So this is extreme vigilance required now.
Okay.
On sharing with stakeholders, we are a very sharing organisation. We don't have any, IP trade secrets as such. We do have a lot of IP, of course, and we are the kind of group that's prepared to share that with anyone. Because if we can help save lives or help you provide better care, or help government, we do that.
Okay, thanks, Graeme. Just before I move on to Jane Meadus, Dava Tarillis and Peter Whitehouse, I just want to acknowledge Jenny Grieve. Jenny is Hall and Prior and Senior Management. So thanks for being on the call with us this evening, Jenny. Jane Meadus, would you like to ask your question to Graeme?
Yes, thank you. I was wondering, what did you do with patients if they were, or residents if they were diagnosed with COVID? Did they stay in the home or were they sent to hospital? What was the precaution to ensure that other residents and staff were not being infected?
Yeah, of course. Look, this is a great question. This gets to the heart of the health management. With the one gentleman that we had confirmed by the authorities refused. Well, it's not fair to say that actually. The authorities said, no, you manage the residents, and we'll help you together manage this resident. So they weren't willing to take their person straight away. And their assessment of us and the resident was that we should be able to work with the authority, see this person to safety. That was their assessment, and they were absolutely right. In other jurisdictions we work in, the local health authority will, on some cases, take with us into their hospitals people we think maybe have all the signs or symptoms of COVID. Swab's been done. If their life is threatened, waiting for the swab, they will take them into the hospital care. So it depends on where you are, on which jurisdiction you're working in. Does that make sense, Jane?
Yep, thank you.
Yep.
Thank you.
And David Turillis, I'm sorry for messing up people's names. David Turillis? Okay, so perhaps if I can, Graeme, how have you planned and supported with the mental health and wellbeing of residents, families and staff?
Phenomenally supported. From the moment of lockdown, and the communication process was extensive by my team. They worked day and night on this. We had a number of platforms to communicate with everyone on instantly. And I've got to say, the public, which is the wider fraternity of members of the families, understood. They got it. That they were very worried. We put in place love windows and iPads for communication. We increased the social investment inside every home straight away. So we did whatever we could to support everyone through this process, through this time period. Now that it's been eased, and I've got to say here, there's a theme taking place. So if the Prime Minister of Australia, which I have to say has done a sensational job, appeared on his parliamentary house and said this, that, and the next thing, the Australian public said this, that, and the next thing. So we all followed suit from the Prime Minister's lead. So when he started talking easing restrictions, well, most of us started to ease restrictions because the public expected that. So the public were listening very closely to governments, and they were supporting us. I've got to say, we were in front of the government position. I'm not being in any way derogatory there at all, but we were sort of moving much faster because of the sensibilities around the risk to our clientele. The public are fantastic.
Okay, thanks, Graeme. So Peter Whitehouse. Peter, are you muting yourself? Because I can see you online. Okay, I will catch up on that question. So we're going to move to David Richardson, Greta, and then Marta. David Richardson, are you on the line?
Yes, I am. Can you hear me?
Yeah, terrific, David.
Yep.
Go.
Yep. My question, I'm from, as you say, I'm calling from Canada. And in Canada, most of the long-term care facilities and other types of senior residents seem to have been caught without sufficient PPEs for staff or even workable protocols for isolating the COVID-19 cases within the facility. And the results have been disastrous. And I'm sure that's true in many countries around the world. So as a lesson learned, is it at a minimum, should it be required that long-term care facilities and other seniors residents have proper PPEs for staff, proper protocols which are exercised from time to make sure they work?
Absolutely. This is utterly non-negotiable for all of us. And the level of PPE has to be at a rate that if you have an outbreak, whether it's influenza or COVID or something else like that, there's enough PPE to see you through that outbreak. Because your staff need it, and so do your residents and families. So it's non-negotiable in my view, and I'll be supported by most of my management there. On the pandemic, on the whole issue of infection control, it would seem to me that some places are really good at managing infection, and other places sadly aren't good at that. And you know, if you look at vitriology, the closer I get to you, if I'm very close to you, if I have got COVID, you'll definitely get COVID. So there's a lot of distancing now required to come into play in the aged care sector, both and disabilities too, both for care at home and care in home long-term care settings. So we have to have almost a revolution in the world when it comes to managing infection, because it's here to stay. It's obviously not going to go away.
Okay, thanks, Graeme. I'll call on Peter Whitehouse now. Peter, just one of your questions, and then I'll move to Greta and then Marta.
Thank you, Mr. Pryor and Jane. Can you hear me now?
Yes, perfect,
Yep.
Peter.
My apologies for before. My question relates to people with dementia who, of course, are more at risk for the respiratory consequences and also social isolation. Has Australia been having conversations about easing death? I'll use that rather gentle word because respiratory death can be rather uncomfortable. What's the conversation about? You mentioned palliative care. What's the conversation about end of life for people with dementia in long-term care? Thank you.
Yeah. If I could talk about your easing of death type scenario, there's been in the last 3 years 2 jurisdictions in Australia, which is equivalent to your provinces. We have 6 governments and 2 territories here. The jurisdiction over a life and over life issues rests with the state governments. And 2 governments have passed through their assemblies legislation to allow voluntary assisted death under very tight circumstances. And one government rejected that, one state government rejected that. So there is a move in the country around that whole issue that sort of addresses your question. The federal government has little influence, has a lot of influence, but little jurisdiction here over this very important issue. However, what the federal government does is have a very good framework in place for end-of-life care, palliative care, and dementia care. We have 42 strictly imposed outcomes of care in Australia for every resident, 24 hours a day, 7 days a week, and there's a very strong emphasis around choice and dignity, respect, decision-making, end-of-life care, dementia care, and those sorts of areas.
Okay, thanks, Graeme. Call on Greta Garnis.
Good morning, everyone. I'll be
Morning.
cogent and concise. I was just wondering, following up on Erka's question, if there's been, I don't know, more collaboration or cooperation with, Leading Age, also the National Association of Supportive Long-Term Care Groups, the National Center for Assisted Living. This question may be for Graeme and for everyone else to see if maybe we're trying to cross-pollinate similar trade associations to work together.
You're from Canada, Greta?
I'm from the States. I'm from the Boston area. So these
Boston,
organizations
okay,
may not exist in certain parts of the world.
Yes.
Just in general, if we're cross-pollinating instead of operating in our own lanes, shall we say.
Own lanes, yeah. Well, this is really perhaps a ideally for Jane, I think. She's on the ground over there. But I ideally hope.
It could be
ideally, of course. Let me just finish in 10. I'll finish in 10 seconds. Ideally hope that we all come together and start to really work together for the future and to learn from a pandemic. Jane, over to you.
Sure. Greta, the way that IFA looks at it, and we respect and acknowledge the work of Leading Age and all its members, we have an opportunity with WHO and the Decade of Healthy Aging, where long-term care is one of the key action areas. And the WHO has an indicator that is about long-term cares in every country around the world. You know, this is a lever that we need to be actually working towards. And so I would suggest, you know, we can share good practices, but that's not going to change the amount of investment and commitment, you know, governments need to put into this area. It is no longer acceptable for me to hear prime ministers and premiers and any other level of government saying, we must do better for seniors. It's not on, doesn't cut it with IFA. So, you know, this is an opportunity in the event of such a tragedy. But I'm happy to talk with you after, Greta, and also with Katie. I call on Marta. Marta, are you with us?
Yes, thank you. I'm calling from Istanbul, from Europe.
Welcome.
Thank you. And fascinating to see the globe on my screen.
Wonderful.
Yes, indeed. A question from Eastern Europe, and I work for UNFPA, so we are supporting a lot of countries in Eastern Europe and Central Asia for the COVID response. And what we are facing, or the colleagues on the ground, is the limited dialogue between the Ministry of Health and Ministry of Labor, who very often, or Ministry of Social Issues, who very often are the owner of the long-term care facilities. And the issue is that first, the demographic shifts in Europe with the aging and the celebration, so to say, of the longevity, practically don't come, the services are not necessarily catching up these shifts. So what we see is very, very conservative, very old-fashioned, restrictive approach to this type of services, which actually results in missing the opportunity to address the needs and well-being of the people. And now the COVID is really challenging. So what will be your advice, following your experience, to facilitate, to steer the reform and change of these facilities, using the opportunity of the pandemic in a positive, constructive way, to make them much more human-centered and well-being approach to be the one in place? Thank you.
Okay. Please, I would invite anyone here to jump into this question, because it gets to the very heart of our future as a global family, global community. If in Turkey, Istanbul, there is general public worry and concern about what's happening in Marta, then that can be really worked with, where it's a role for NGOs and the media, dare I say this, to work together with other community groups like church groups and community groups, community organisations, charities, and the union movement to form some kind of coalition for improvement and reform. It's a painful period to go through. We'll all go through this. We've been through it in Australia. It's very painful for everyone. But if government are really worried about this, then you will see long-term reform. There are big issues around who will pay for it and who will regulate it. They're big issues as well. But at least the pandemic, I think, as you say, gives you the beginnings, the momentum to kick off on. And we can't lose this in the world community. This is a very good, sad silver lining out of the pandemic. The reform process will begin again.
Okay.
Jane?
Thanks, Graeme. We have 3 more questions, and that's probably going to be, then we'll move into wrap up. Francis, Mosa, and Anita. So Francis Wilkinson, are you on the line?
I'm in Toronto. Yes, I was just wondering, in Canada, one of the biggest problems we've had with long-term care is that there are often multiple people in a room, you know, 2 or even 4 patients sharing a room, and that certainly contributed to the spread of COVID here.
Yep.
And I was wondering if that's
Yep.
true in Australia as well, or whether you have more private room facilities.
Australia's has a lot of both. So we have a national code for construction in Australia that governs across all of Australia, a building code basically that determines the construction or full renovation of an existing facility, and that requires no more than 2 people per room with their own ensuite, with an average of 1.5 to a facility. So that's the bright future that began about 10 years ago. So we've got a lot of older stock, which I'm responsible for some myself, to be honest with you. And in the end, I think you'll see older stock and new stock in Australia at no more than 2 per room. It'll take some time. The isolation of a confirmed case of COVID or a suspected case of COVID, that person has to be put into instant quarantine in the home. So that means a single room, single bed. It could be normally for 2 or 3, but on the moment the nurses and doctors suspect someone could be seriously with COVID or influenza, they have to be moved to safety to a single room.
Thanks, Graeme.
The greater good. Yep.
Mosa Khan, are you on the line? Okay, we'll move on to Anita. Anita Kells.
Yes, hello. Can you hear me?
Yes, Anita.
Yes.
Okay, I have a question in view of the huge number of deaths that have happened in the old care institutions everywhere, including in Finland. About half of the people who have died in COVID here have actually taken place in old age institutions or in old care at homes, which is also very common in Finland. And so, and in view of the second wave, which you also mentioned, which may be coming within 10 years or maybe is already around the corner in some cases.
Yes. Yes.
What would be the most urgent precautions that we should now do? I mean, you mentioned the strategy or some kind of policy that you have with indicators, I guess, but is there something else that we can do to better prepare?
Well, there's a number of issues we've got to do. We've got to ask ourselves about this whole issue of our society's attitude towards the older people. So it's called ageism, or it's called discrimination, or call whatever you want to call it. This has to be seriously looked at as a matter of urgency. So just because you're 75 or 95, it doesn't mean you can't live a full life. And how we address this and how we ask governments to properly regulate for good care for these people is at the heart of that. So I would strongly encourage you to talk to your government about regulatory authority over these institutions, these nursing homes in Finland as an urgent priority. That you'd want to have a framework that links funding to quality of care. So if you don't have quality of care, then they should, in my view, lose funding, or funding should be frozen for those homes. You want a regulator with real teeth that will have the capacity to deal with the owner or the manager of that home, and put the rights and interests of the people in care there number one priority over everything else.
So Graeme, there's been a couple of questions about standards in care homes, and perhaps you could just talk a little bit about standards in Australia. And there are more questions coming through, so we won't be able to get to them, but perhaps we may actually encourage you to come back and do another town hall. But could you actually talk about standards? So
yeah, we have, in the Australian aged care context, we have, it's a federal structure. It's not federated, so it's single government called the Federal Commonwealth Government of Australia that funds, regulates, and is responsible for the care of all Australians over the age of 70 to fund their doctors, their dental health, and of course their care and end-of-life care wherever they choose to spend their life in the last years of their life. The regulator is new, as mentioned in my introduction. It has a very powerful set of teeth. It can close down a home, it can sanction a home, it can remove funding, and it's run by some very, very competent, autonomous people. They are very consumer focused, and broadly speaking, there's 8 standards, and there are 42 care outcomes. Now, this is the heart of it. The 42 care outcomes can be tested at any time, unannounced, 24 hours a day, 7 days a week, by inspectors that are all nurses, by and large. And the 42 outcomes of care there must be evidence of that for every resident, 24 hours a day, 7 days a week. So it's pretty tough. It's really tough to deliver on that. And there's no negotiation around that today. I must say that to you. If you fail, you fail. You can pass sometime in the future, but you have a long way back from a failure to a care standard.
Okay, thanks. Margaret Gillis, I just want to acknowledge Margaret and her leadership in Canada and internationally around the rights of older people. So Margaret, you have the final question to Graeme.
Thank you for the presentation. And I'm hoping, Graeme, that you would share those standards with us. I think Canada has a lot of reckoning to do in terms of what's happened, the human rights of older persons with regard to long-term care. And I think we need to learn from countries where they have upheld standards and where the older people have not been impacted in the same way. So I think this has been an incredibly valuable meeting, and I'm really thankful, but please share those guidelines.
No problem. We'll definitely will, straight away.
Okay, thanks, Margaret. And of course, if you want to have another town hall about, you know, standards, accreditation, what it looks like, sounds like, smells like, then just let us know. You know, these town halls are informal so that everybody can actually share and also have questions. You'll see in the chat box, there's been lots of questions, but also resources. So we capture the whole chat box and organize it and then put it up on the website and send it out with the link for the video. We've got one last question. Mosa has come back online. So Mosa, would you like to share the question with Graeme before we wrap up?
Okay, so I had just a quick question for Graeme. Based on your lessons learned, what sort of changes or reforms do you envision within the long-term care sector in a post-COVID-19 world? And if you could also give us some ideas about what sort of challenges or planning do you see over the medium to long term in terms of reforming or modernizing the sector based on the lessons learned that we have seen through the COVID-19?
Well, it all depends, to be really open with you, where this sits on the national priorities list for every country. So we are about to enter into an economic storm, or we're in the storm already, and it's very damaging to all countries and all societies. So if that occupies the top 10 list of issues, then aged care will come after that. So that's part of the issue we're dealing with. In terms of where we go, then I certainly hope that through long-term care associations, through IFA and with the World Health Organization, we can use our partnership with the World Health Organization to have a conversation with a bit of meaning to all of the partner countries in the world that belong to and run WHO. It would seem to me it's through WHO that we may be able to get a platform for change. Because by ourselves, it's too hard, Mosa. It's just too difficult. And then, of course, there's issues of who will pay for these issues and how long will it take. In Australia, just in concluding, Our Royal Commission, as I mentioned that earlier, has been going now for over 12 months. It has a single focus, and that is to examine the quality of care and care standards of care in Australia. It's not looking at anything else besides that. So home care, mental health care is all part of this. It won't touch disability care. And the Royal Commission is very keen to examine what took place in our 2 homes in Australia that had a number of deaths as well. Not to attribute blame, but to look at lessons learned. So I think all governments have to sort of look at this very carefully. Otherwise, it'll come back and it'll haunt us forever. So IFA has a primary role here, hence from tonight, to work with everyone, anyone, world government, all governments, to really help a conversation longer term around how we learn from this and never happens again.
Okay, thank you, Graeme. And I'm going to come back for one last comment after I've done some housekeeping to close up.
Okay.
But,
yep.
Some people have said bring Graeme back. I don't know whether that's the fan club, Graeme, but there is interest in having, you know, another session, whether we look at reform, systems, how do we collaborate, but there is an interest, so we'll talk with you offline, and please just populate the chat box should you have any other ideas. You know, long-term care really strikes at the heart of all of us, because we've seen in the starkest possible way that, you know, the lack of investment impacts the lives in the most brutal way of older people. So we thank you for all being on the line today and participating actively. IFA will continue with these town halls. The next week's town hall is Facts and Fiction in Communication in Times of COVID. You know, NGOs around the world are really struggling to get this balance around how do we communicate what and to whom and to how, and to almost be, you know, above the noise of COVID. So we're just delighted and privileged to have Mr. Peter Evans and Mr. Eli Singer with us next week, next Friday at 7 a.m. And they're both formidable in what they've done, who they are, and the leadership they've shown around the world. So the last comment, Graeme, goes back to you before I thank the IFA staff who are all online. We're moving into 10 weeks, team, and we're down the other side. So IFA team, just stay the course and we'll get through to the other side. Thanks to Andra, to Chesley, and to all of us on this line. So Graeme, can you please take us out?
Well, first I want to thank everyone for being on the line tonight. It is heartbreaking what's taking place. You can only feel the pain of everyone, the families and people who have passed away, the people who are scared. But we can't forget people in the communities who are living in their own homes with their families. They're also very scared. Everyone's frightened now. And so we have to step up and we have to really comfort and support these people. So if we can share best practice, if we can share a platform for reform, if we can all get together and work with ourselves, there is a key role here for NGOs. The NGOs are the key to major reform taking place, to work with governments and the media in a very supportive, positive way. In closing, I do want to thank the staff of the IFA. Jane she starts work at 4 a.m. And Greg, they're an amazing team working with their staff. So we thank you, Jane, for your incredible work, and everyone on board tonight. And we have to move forward, but we will share, whatever you want shared, we'll share with you in terms of best practice, policy format, frameworks, and what's taking place. So have a lovely morning in the wherever you are, or a lovely night wherever you happen to be. Thank you very much.
Thanks, Graeme.